So one of the points for skin problems, eczema, acne, psoriasis is here. Could you please put your head forward, down a bit? The reason I have asked for that is that if you can see at this angle, there's a bone that sticks out a bit more. That's the seventh cervical vertebra, neck vertebra, 1, 2, 3, 4, 5, 6, 7. Don't need to count them, but it's there. So because these cups are quite big, you don't have to be that precise. You kind of load the plastic. I'm holding the camera with one hand, so it's not going to work well, but you load this plastic thing into this holder, and then you place it over here, over that bone, and it's probably better if you have your head not down and just in a natural position, because otherwise you're going to... And then you pull the pump a few times and make sure the patient is not too uncomfortable. Is that okay? But can you feel some suction but not too much suction? Okay, how about now? Yeah? Okay, so then you just take this off. I'm having to do it with one hand, but you take it off. There you go. And if it's too tight, you can adjust it with this red valve. However, it may be that it's not that precise, and if you try and adjust it, it lets all the air out and it comes off, in which case you put it back on again and just don't... You can count how many times you pull the suction. So this point is called C7. In Chinese it's called Da Zhui. Da Zhui means large hammer, because the vertebra sticks out. For some reason they thought it looks like a hammer. So this point removes heat from the body. So when you have red spots or red eczema or red psoriasis, that's heat. It's the color of fire and so on. And you leave these cups for about 5 minutes. Not usually needs to be longer than that. If for some reason the cup doesn't stick, you can put some oil or you can put some water and then it will stick. So that's one. So the other point, I won't do it on camera, I will just show you where it is, just because I've got my hands full, is, for skin problems, is you ask the patient to, basically you have to find the bottom of the shoulder blade. It's a triangular shape like this, but you have to feel the bottom. You can't usually see it. Actually, on this young lady, you can feel it. So it's there. You're not going to see much, I think, on the camera unless no. So, but if it's not obvious, and on some people it's definitely not obvious, what you do is you ask them to gently put their hand a bit kind of like behind their back, like a kind of policeman in a cartoon, and then that makes it, now you can probably see it, that makes it stick out more. Then you let them put their hand back in a natural position, and you aim the cup there. Actually, I beg your pardon, not on the tip of the bone, it won't stay on very well. Just you aim see if I can. So you aim the top of the rim of the cup just under the bone on either side. And when I've done cupping on various people, especially ladies, even if it's nothing to do with skin conditions, often I would find that cupping here would produce a particularly black mark. You can do both sides on this. So a particularly black mark means a particularly great deal of not energy flowing well, and I was a bit confused for a while as to why that is, but I concluded that it's because of menstrual problems. And so what do menstrual problems have to do with skin? Well, they do have some hormonal sort of things, but in Chinese medicine they think that overheating blood causes skin problems. That's different to modern medicine, but so this is a blood point. It's called BL17 is the code name, if you technical name. This one I think is, I don't remember I don't remember the number. I think it's CV17. This one, I don't use the numbers, I use the Chinese names. They're a lot easier to remember. So this one is, the Chinese name is not very useful, but it's BL17. And it's at the level of the 7th thoracic vertebra, T7. But the average home user of a cupping set doesn't care what the number of the vertebra is, but that's where it is. That's it. And then you leave both for 5 minutes, you take them off. Depending on how dark and black they get, it indicates that there's more of a problem going on there. That's all. Bye!